In one Australian aged care home, a single nurse was responsible for 32 patients in regional hospitals across the global south. Patients are airlifted hundreds of kilometers just to access basic surgery. The response? Robots. Surgical robots, delivery robots, companion robots. But here's the question no one's asking. Do they actually help? Or are we replacing one crisis with another? Welcome to Tech Disruptors, where we go beyond the buzzwords. Today, we critically unpack the rise of robotics in healthcare, the promise, the paradoxes, and the very human questions machines can't answer. If you care about where tech is really taking us, make sure to like, subscribe, and follow our deep dive series, only here on the Tech Current. Let's be clear, robots can help. They can assist in surgery, reduce human strain, and deliver supplies. But the hard truth? Most failures have nothing to do with hardware. They fail because they don't fit the reality of hospitals. In one hospital, medication delivery robots were celebrated until staff realized they required constant resets, stalled in corridors, and increased delays. In surgical theaters, robot-assisted knee replacements looked great in brochures, but a peer-reviewed study showed no improvement in pain or recovery compared to traditional methods. Even worse, robots rolled out without enough training slowed down surgeries, not sped them up. In aged care homes, robots are used to lift patients and offer reminders. But does that mean they're trusted? One caregiver in Japan dressed their robot as a cat. It was cute, even comforting, until it backed into a patient's wheelchair. These are what researchers call experiential ethics. The real problems only show up once robots enter the room. Can a robot notice if a patient is quietly in pain? Can it pick up subtle changes in body language? Trust isn't earned with sensors. It's built through relationships. It's not just doctors and nurses pushing robotics forward. It's tech giants, Google's Verily, Microsoft's Azure, NVIDIA's AI chips. They're already embedded in surgical vision systems, data analytics, and even robot decision-making. But the ethics haven't caught up. Many hospitals don't know who owns the data, what happens when AI fails mid-surgery, or what rules apply when robots cross borders. In private facilities, robots may be deployed without oversight, especially in aged care, where vulnerable populations can't always opt out. Now, the upside. In rural Ghana, a mobile telepresence robot helps local clinicians consult with city-based specialists. In Tokyo, AI-driven care bots reduce nurse injuries and help dementia patients manage routines. In regional Australia, exoskeletons are being trialed to extend careers for aging care workers. This is where robotics shines, not as replacements, but as multipliers. If designed with empathy and deployed where human support is missing, robots can bridge gaps, not widen them. Robotics won't save healthcare, but they can support it if we act wisely. Teens and students, learn tech fluency, but double down on emotional intelligence. The robots won't replace you, but someone who knows how to work with them might. Parents and patients, push for consent. Ask what data robots collect. Demand care that puts people first. Hospitals, build trust before you deploy tech. Training, feedback loops, fail-safes, or your robot rollout might backfire. Governments and industry, support standards that go beyond safety, include ethics, transparency, and patient dignity. Robotics in healthcare is a tool, not a fix. It can extend our reach, but it can't replace our presence. We don't need machines to be perfect. We need them to be accountable, and for us to stay human in the loop. Thanks for watching Tech Disruptors. If this gave you something to think about, subscribe and share your view in the comments. Next time, we're stepping into a new dimension, mixed reality. We'll explore how companies are using AR and VR to transform workforce planning, from immersive training to reimagined workspaces. It's not just virtual, it's transformational. See you in episode 6.